I'm Dr. Rick Buck, and I've been a dentist for 17 years. In this video, I will go over how I do crowns on back or molar teeth. This patient fractured their back tooth, as you can see here. And if you tried to just put a filling on top of this where they broke it off, it itself would actually break off all the time. And so the best way to remedy the situation is to do a crown. Before we start, we place this stuff called liquid dam on the tooth to kind of build it up, and then we take an impression of that, and we're going to use that impression later at the end of the appointment to make a temporary crown. So just hold that off for now. After the patient is numb, we start filing the tooth down for the crowns. Now, the tooth fractured because they had a filling done on this tooth years ago, and some teeth can't take too much pressure and have a filling in it because the tooth will just kind of get cracks and microfractures, and in time those get bigger, and then eventually it will just kind of break off, which is another reason why doing a filling on this is pointless. It's because this tooth had a filling which was likely necessary at one point, but over time, without enough structural integrity because of the filling, the tooth developed those fractures and broke off. The irony is, though, to fix this, we have to file the tooth down even further. Now, luckily, the tooth didn't fracture too deep, because if it did, or if it fractured in a different way, we wouldn't be able to likely save the tooth, and we'd maybe have to take out the tooth or possibly even do a root canal before we can do the crown. Luckily, the fracture here is not too bad, so we can just file the tooth down and we still have plenty of sound tooth structure that a crown can hold onto. So just so you know, when I'm filing this down, I'm not aimlessly filing it. We file the tooth down 1.5 millimeters in every direction at least. This means we drill at least 1.5 millimeters off the top and then all the way around the circumference of the teeth. As I do this, there are a few things I'm checking for. The stump that is left behind has to meet a few criteria for a crown to fit nicely on top of it. The circumference of the stump is called the walls of the tooth. We need the walls of the tooth to converge at about a 5 to 10 degree angle. If it's more than that, the final crown is likely to come off from time to time. If it's less than that, the crown may not fit, or it might possibly get stuck on when you're trying to try it in. And so either way, 5 to 10 degrees will give a lot of retention and still allow it to fit. We remove 1.5 millimeters because a crown is going to fill in all that negative space that we drill away. If you just put a crown on top of the tooth without drilling it down, when the patient bit down, they would bite only on that tooth due to its added thickness. The thickness that we drill away needs to be at least 1.5 millimeters for it to resist breaking. And that's because the patient is going to chew on this over and over for the course of their life. And so thickness makes it stronger. An important part of what we leave behind when we drill on the tooth is the margin. The margin is important for a few reasons. The biggest reason is that this is where the tooth and the final crown will meet and is the weak point of the tooth going forward. There needs to be a smooth transition from the tooth to the future crown, or decay and bacteria and plaque can easily enter, hide, and cause cavities here, making it impossible to keep clean if it's done improperly. Once I'm done preparing the teeth for the crowns, I should be able to look down on the tooth and see the complete walls all the way around the circumference of the tooth when I am checking the margin with my little mirror that you see here. So I should be able to see the complete wall all the way down to the margin, all the way around the tooth at the same time. I then check there is a 1.5 millimeter clearance when the patient bites down between the upper and the remaining lower tooth. If the prep, as I call it, or the remaining stump of the tooth meets all these requirements, I then can move on to the impressions of the tooth. But first, I stop the gums from bleeding so I can get a detailed impression or scan of the margin. I usually in my practice take scans now, but for this video, I will do impressions. We do this in 2 steps. First, I take an impression with a quick setting hard material called Blue Bite. Then I remove the impression when it is hard And second, add a more detailed impression layer with a material that's able to get into all the detailed and crevices to get a more accurate impression. And so I just snap this impression with the material back into place in the mouth. This method pushes the material below the gum level to get a highly accurate impression of the margin. Next, I retake the shade of the tooth. The dental lab will take this impression and make a model of the teeth and build a crown around that tooth with the shade that we take here. We will then get the crown back in a few weeks. In the meantime, we make a temporary crown at the end of this appointment. My assistant does all of that, so let's just fast forward to the appointment where we clean off all the cement left behind from the temporary crown. You can see how it looked as we take it off here. Once it's all off, we start trying in the final crown, and as we do that, we are observing for 5 things. Quickly, before I get to the most interesting part, I developed the best toothbrush, floss, and other dental products that are in Amazon affiliate links in the description. Those dental products will give you a stunningly clean mouth. You should watch my videos about why they are the best, posted at the end of this video, so you brush and floss with superior results. First, we make sure the crowns contact the adjacent teeth adequately so they won't get food caught in them. And we do this by making sure floss snaps nicely between them. Second, we ensure the crowns sit down all the way and don't rock, or they will likely loosen in time or have other issues. Third, we make sure where the tooth and crown meet is flush. Otherwise, cavities can easily start at the margin like I explained earlier. Fourth, we check the patient is biting evenly on the crowns. And then fifth, we make sure the crowns look good. Our patient loves the way they look. You will notice the gums look irritated at this appointment, but the gums will all heal up in a few days to a week or so. This crown meets all of our parameters, so we then cement it into place with a glass ionomer that we mix up. Excess cement will express out while we are holding the crown firmly into place. So we will clean up some of it now and some of it after it sets in a few minutes. The patient bites on a cotton roll to hold it firmly into place as it sets. This stuff is extremely strong and will hold the crowns in for the rest of the patient's life if they take care of them well. Now let's look at the before and after of everything. This looks nice, and I know that the patient is very happy with this, so this is the way it all looks and this is the way it goes. Watch all my daily tooth care videos I have posted now for the best techniques, tips, and products for a stunningly clean mouth that avoids tooth decay and gum disease and gives you fresh breath. My dental products are in Amazon affiliate links in the description below, and if in Southern California, my dental office is in the description as well. If you're a dentist with a digital scanner, my brother's incredible dental lab is in the description, and he can work with you anywhere inside the United States. Like and subscribe to my channel if you have teeth.